It is a medical emergency. The definition is a state of absolute or relative insulin deficiency which leads to altered glucose metabolism, profound dehydration, acidosis and ketonemia. So these all components should be there because absolute insulin deficiency means there is actually no insulin. So which is seen in type 1 diabetes, and relative insulin deficiency is seen in type 2 diabetes. So these are two different entities. There is absolute insulin deficiency and relative insulin deficiency. So coming to absolute insulin deficiency, if the type 1 diabetic patient skips 2 or 3 or 4 doses of insulin, they may land up in diabetic ketoacidosis. So it is one of the presenting symptoms in type 1 diabetes. Why? Because the insulin is the key factor preventing ketogenesis. So whenever there is an insulin deficiency, ketone bodies are formed in the body. So next thing, relative insulin deficiency, that is seen in type 2 diabetes. So in type 2 diabetic patient, there is actually some amount of insulin is there in the body. So the type 2 diabetic patient usually doesn't present as DKA, but due to some precipitating factors like endocrine infections, maybe a urinary tract infection or a myocardial infarction or a cerebrovascular accidents or surgical procedure, these can lead to diabetic ketoacidosis. So it is a presenting problem in type 1 and uncommon in type 2 diabetes.